Hi, I'm Oli, and I'm really excited to be joining this year's Nova conference. I am one of the co-founders of Soda. We are a social enterprise based in London, and we help organizations to design health and wellbeing solutions with communities rather than for communities. Today, I'm going to be telling you a little bit about a public health initiative we've been involved in, which is called the Community Chest for Social Prescribing. And I'm really excited to give you an introduction. Let's start by covering social prescribing. Some of you may be familiar with this, some of you may not be. Social prescribing is a new way of improving and supporting the health and well-being of local people, and it's based on the insight that many things, if not most things, that affect our health can't be treated by doctors or medicine alone. We're talking about things like loneliness, poor nutrition, or stress due to financial pressures or poor housing. It's estimated that in the UK, currently about 20% of patient appointments with their family doctor, or their GP, as we call them in the UK, are spent on these wider determinants of health, these social determinants of health. So this is where social prescribing steps in. Social prescribing connects people to non-medical support to address these issues and other unmet needs. Now, where are people being connected to support? Well, some people are being connected to support provided by government services, but the vast majority are being connected to support in their local community. This is support that's provided in the activities and services that are put on by your local charities or local community centres or grassroots groups of residents coming together to help people connect and enact lifestyle changes that will improve their health or well-being. So social prescribing is all about tapping into the power of communities to generate health. What's happening with social prescribing in the UK? Well, the NHS has embraced it and it's committed resource to rolling it out across London. Its long-term plan set in 2019 set a target that by next year, every GP practice, so family doctor practice in England, will have access to a social prescribing link worker. So the social prescribing link worker is the individual who's based in the healthcare setting, who's signposting and connecting people to community-based support with their health and well-being. What have some of the challenges been in the rollout of social prescribing? Well, there are two that I want to discuss now. One is that often these local voluntary and community groups are expected to deliver their activities and services for additional patients and residents without additional funding. And some of those new referrals are coming with various complex health needs. And secondly, there's often been a lack of communication between the different parts of the system and a lack of understanding between the health system and then the community groups who are delivering the activities. So this is where a community chest for social prescribing comes in. So what a community chest for social prescribing does is it brings together a range of local partners from the local health system, the local government, and the local community. And it brings them together to do two things. One, it brings them together to collectively discuss the health and well-being priorities of a local community. So trying to understand collectively which population groups are experiencing adverse health outcomes and why might that be? Where are the local community assets that are already acting at capacity and need a little extra support? And the second thing that this partnership people do is they collectively invest funding towards those voluntary and community groups who are providing activity which responds to these health and well-being priorities. So a community chest is a funding pot which takes investment from both the NHS, our National Health Service, but also from local government and potentially other sources such as local businesses or philanthropy. And then it channels that funding in a participatory process that involves all the parts of the system coming together. What's the impact? Well, one, it creates more joined up thinking between the health system and the local voluntary and community sector. Two, it leads to more intelligent investment into those community-based activities that are really making the biggest difference on the health and well-being of local people. And that, as a result, leads to better access to support and improved health outcomes for those in a community who are experiencing the poorest health and the poorest health outcomes. So it channels investment into the community, and it works with the community as equal partners in the process. Where is this happening? Well, we have been running pilots in various areas across London, each section of London, each area taking their own innovative approach to pulling together these multi-stakeholder groups. And we have ambitions to work with additional partners across the UK to scale this nationally. And hopefully with the support of this wider Nova network, we can get this model up and running beyond the UK too. Thank you very much for listening. I'm really excited to learn from others as part of the conference, and do get in touch if you have any questions.